Hello friends, my name is Winnie Byanyima. I lead the UN Global Response on HIV. Thank you for inviting me to speak at your flagship event. I'm very concerned about the colliding epidemics of HIV and COVID-19, especially because even before COVID-19 struck, we were not on track to meet the global HIV prevention targets for 2020. Now COVID crisis risks blowing us way off course. The AIDS pandemic remains a global crisis fueled by inequalities, but the urgency associated with the response is waning and millions are being left behind. That worries me. We have not reduced the number of new HIV infections at the rate we committed to. Last year, there were 1.7 million new HIV infections, and every single one of these could have been prevented. Denied their right to health, marginalized groups such as gay men, sex workers, transgender people who inject drugs and their partners, they make up over half of all new adult infections. Every day, these groups don't get the health care they need, they are criminalized and they are marginalized. Meanwhile, women and girls are too often denied their sexual and reproductive health and rights, and gender-based violence and inequalities continue to drive the epidemic. Across sub-Saharan Africa, young women and girls face rates of HIV far higher than men and boys of the same age. We should be outraged because we have the evidence, the tools, and the commitments to prevent every new infection. But we are clearly not reaching people with the services they need. COVID-19 is seriously disrupting HIV prevention and support services for key and vulnerable populations. Lockdowns are hurting the poorest the most and increasing vulnerability. And we are seeing an increase in marginalization and abuse of human rights. This makes our prevention work even more urgent. In at least 1 in 4 countries reporting to us, prevention of mother-to-child transmission services have been disrupted. To put this in context, if prevention of mother-to-child transmission services are disrupted for 6 months, our models show that this could lead to an increase in new HIV infections in babies by as much as 83% in Mozambique, 106% in Zimbabwe, and 139% in Uganda. This alone would reverse all the progress over the past 10 years in preventing new infection among newborns. COVID-19 lockdowns are having a terrible impact on women and girls and key populations. Sex workers, transgender people, people who use drugs, and gay men have lost livelihoods and face violence. They are also denied social protection many times. They are scapegoated as the transmitters of COVID-19. Our country offices are reporting disruptions in support services for key populations. In short, the crisis in HIV prevention is being made worse by COVID-19, but we cannot focus on just HIV or just COVID. That's a false dichotomy. We must do both. The right to health means that no one disease should be fought at the expense of the other, and we cannot divert investment from HIV and other diseases. Any reduction in resources for HIV prevention in the face of COVID will only make the current HIV prevention crisis worse. COVID-19 is a new crisis requiring new, not reallocated resources. It requires renewed energy and robust leadership. What we desperately need is a different politics to guarantee the right to health of everyone, everywhere. Closing the prevention gap means dismantling injustices and inequalities which put young women and girls, gay men, sex workers, transgender people, people who use drugs, prisoners and migrants at great risk of being infected with HIV. Prevention services must be considered essential services during the COVID response and lockdowns, particularly the commodities and support services that vulnerable groups rely on. We need to reach population groups and locations with the highest rates of new infections with prevention options that work for them, how in the way they live their lives. We must reach people with what they need where they are, from delivering prevention commodities through community service points to expanding the use of virtual peer platforms to rolling out HIV self-testing. And it's absolutely critical that we mobilize the investments we need for effective prevention even in the midst of another pandemic. One last word. I want to recognize the critical role of civil society and responses led by and for the community. You've always played a central role in raising awareness, providing information, dispelling myths, and you've led the way when it comes to connecting key and vulnerable populations with services. Now more than ever, community leaders should be supported to deliver and should be recognized and resourced as essential service providers for both HIV and the COVID response. Resilient health systems rely on communities. We need you. We need you for HIV and for COVID and for the next health crisis. I thank you.